My child is pale is a common complaint that brings parents to the doctor. In the next series of slides, we are going to discuss whether pallor is only related to anemia, and if it's related to anemia, to understand the definition and classification of anemias, to understand the pathogenesis and the clinical approach to a child with deficiency anemia, to identify causes and understand the pathogenesis and clinical approach to a child with hereditary and acquired hemolytic anemias, and to understand the pathogenesis and management of aplastic, hypoplastic anemias. Pallor is unusual lightness of the skin color as compared to the individual normal complexion. It may result from reduced blood flow and oxygen to the skin, or a decreased number of red cells, what we call anemia. Skin pallor can result from many causes apart from anemia. It can result from cold exposure, hypothermia, hypotension, shock, heart failure, arrhythmias, dehydration, acute infection, motion sickness, allergy to drugs, migraine, heat stroke, blood loss, hypertension. So, pallor is not equal to anemia, and it should be investigated properly to diagnose anemia. What's anemia? Anemia is defined as hemoglobin level below the normal for age and sex. The hemoglobin is the molecule causing oxygen carrying capacity of the red cells. Red cells are produced in the bone marrow by a procedure called erythropoiesis. This is the process of development, differentiation, and maturation of the red cells from primitive stem cells. Primitive stem cells, they get mature into lymphoid stem cell and myeloid stem cell. The myeloid stem cell differentiates into red cell precursors, platelet precursors, and myeloid precursors. Red cells, during their maturation, they will undergo various phases with changes in the cytoplasm and the nucleus into erythroblast early, and then late erythroblast, and then into normoblast having a nucleus and loss of the nucleus, and we get the reticulocyte, and then they go to the circulation as mature red cells containing no nucleus and unable of proliferation. Increased reticulocytes in the peripheral blood means active erythropoiesis, and when there is stress erythropoiesis, you may get in the peripheral blood normoblast, means red cells containing nucleated red cells. Erythropoiesis is stimulated in response to low oxygen in the circulation through the hormone erythropoietin produced by the kidney, and we should know that the lifespan of the red cells is 120 days. The hemoglobin molecule consists of 4 globin chains and 4 heme subunits, and every heme subunit consists of a protoporphyrin ring and an iron atom, and each hemoglobin molecule binds 4 oxygen molecules. Each red cell has more than 600 million molecules of hemoglobin. They carry oxygen from the pulmonary alveolus, where the hemoglobin is 97% oxygen saturated. They leave to the circulation, and then they release oxygen to the tissues. So if speaking of anemia definition in pediatrics, we should speak that it's hemoglobin below the normal for age and sex. What are our expectations at birth? Normal hemoglobin is 19 grams plus or minus 2 grams per deciliter. Then there is a fall in the hemoglobin concentration during the first 3 months of life. This is physiological. Then later on, anemia is defined as a hemoglobin concentration less than 11 grams till the age of 5 years, less than 11.5 between 5 and 9, less than 12 between 9 and 12. And then at adolescence, we expect that the lower limit for girls is 12 grams, with values higher in boys. Anemias can be classified etiologically into deficiency anemias, hemolytic anemias, hypoplastic anemias, as well as others, anemias where there are impaired iron utilization, as well as anemia of inflammation, anemia of chronic disease, malignancy, collagen disease, anemia of uremia. In the next module, we are going to discuss deficiency anemia.